Good evening, everyone. Namaste. This is Dr. Aparna. I am an Ayurvedic psychotherapist. I am your emotional healing synergist. I act as a catalyst and support your emotional healing journey. I am an infopreneur and a medical writer. In my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I come up with discussions on Ayurveda, mental health, psychotherapy, and related aspects. So, before saying anything, happy Yugadi and Gudi Padwa to all. In the previous session, we were discussing about ADHD. So we have discussed about ADHD in two of the sessions. You can get both the sessions on LinkedIn and YouTube. Um, Today we are gonna discuss about the role of teachers and schools in helping in managing ADHD children. So, and importance of therapy. So, what is the importance and impact of therapy in ADHD? See, for who have missed, to just brush it up, ADHD is a neurodevelopmental disorder. ADHD stands for Attention Deficit Hyperactivity Disorder. So, it is a common condition that affects how a person focuses, sits still, and controls their impulses. So here's a breakdown. First thing in ADHD is trouble focusing. So people with ADHD might find it hard to pay attention in school, at work, or even during conversations. So they might get easily distracted by sights or sounds around them. And then hyperactivity, so this is more common in children than in adolescents. They might have excess energy and find it difficult to stay still for long periods. Impulsivity, so this means acting without thinking things through first. So people with ADHD might blurt things out or make choices without considering the consequences. See, we have discussed the parents' role in the previous session. If you want, you will get it in my videos. So, teachers and school. Today we are discussing, the role of teachers and school. So, teachers and school can play a critical role in supporting, adolescents with ADHD. So, by creating a structured and supportive learning environment and implementing specific instructional and behavioral strategies, they can empower these students to thrive academically and socially. So, here's a detailed breakdown of their roles along with illustrative scenarios. So, how to create a supportive environment? So, first thing is structure and routines. So, adolescents with ADHD often struggle with transitions and maintaining focus in unpredictable environments. So, schools can create a predictable and structured environment. How? Consistent schedules. That means implementing consistent bell schedules with clear visual cues, that is, flashing lights before transitions, can provide a sense of order and reduce, anxiety. And organized classrooms, so arranging desks strategically to minimize distractions from hallways or windows, and maintaining a clutter free environment. So this allows students with ADHD to stay focused on the lesson rather than the hallways or windows, etc. So first scenario. See, there is a 14-year-old girl with ADHD. So she finds it overwhelming to switch classes quickly between lectures. So the school implements a consistent schedule with a 5-minute warning bell before transition. So this allows that girl to mentally prepare for the shift of the class, the next lecture. and reduces disruptive behavior in the hallways. So the next scenario could be there is a 15-year-old boy with ADHD and gets easily distracted by visual stimuli. So the teacher keeps the classroom organized and minimizes clutters on walls and bulletin boards. So what happens? This reduces distractions and allows the boy to focus on the teacher's instructions. The second thing is reducing distractions. So ADHD can make it challenging to filter out irrelevant stimuli. So schools can minimize distraction in various ways. So, how? Seating arrangement. So, seating students with ADHD away from windows or doorways minimizes visual and auditory distractions. The second thing is learning stimuli. That means during independent work time, minimizing background noise, that is, turning off the projectors and providing students with fidget toys. So, um see you they should not have excessive stimuli. That means minimizing all the background noises and providing them with fidget toys which is approved by teachers, so can manage them help can help them manage their energy and focus on the task at hand. So here in the first scenario, we have a boy who is 16 years old with ADHD. So he finds it hard to concentrate if he sits near the classroom door. So what the teacher does is the teacher strategically places his desk away from high traffic areas. That means doors, windows, and if he could see hallways, all of that, away from all of that. So allowing him to focus better on the lecture. So there is a girl who is 17 years old in the second scenario with ADHD. So she fidgets and struggles to sit still for extended periods. So teacher allows Emily to use a fidget toy while working on her assignments. So what happens is using this fidget toy, this helps her manage excess energy and stay on task. The second thing is the next thing is instructional strategies. How to give instructional strategies. So clear and concise instructions. So students with ADHD may struggle to follow lengthy or complex instructions. So teachers can improve comprehension by chunking information. So breaking down complex instructions into smaller manageable chunks and manageable steps, and providing written instructions on the board or worksheets. All these allow students to refer back and avoid confusion. So breaking down complex instructions into smaller and manageable steps. Second is checking for understanding. So regularly checking in with students with ADHD whether they're understanding the concept or not, so ensures they grasp the lecture or the material. So this can involve asking clarifying questions or having students restate instructions in their own words. So first scenario here is there is a boy who is 14 years old with ADHD often misses key points in long explanations. So what the teacher does is the teacher breaks down a science experiment into smaller steps, writing them on the board alongside with visuals. So John can refer to the instructions throughout the experiment. So the next scenario is there is a 16-year-old girl with ADHD who feels overwhelmed by a complex math equation. So the teacher checks in with her after explaining the steps. So if she seems confused, the teacher patiently breaks down the process again. That means explains it to her again. So ensuring her understanding before moving on. The next thing in the instruction comes the multisensory learning. That means not all students learn best through traditional lectures. So teachers can cater to different learning styles by incorporating visual aids. For example, utilizing diagrams, charts, and graphic organizers can enhance understanding and engagement for students with ADHD who benefit from visual cues. Next is kinesthetic activities. So, integrating hands-on activities, group projects, or movement breaks into lessons can help students with ADHD release excess energy and refocus on learning. So, giving them some and involving them in hands-on activities or group projects, or into movement breaks into lessons. So the all these can help students with ADHD release excess energy and refocus on learning. So, for a first scenario here, we have a 15-year-old boy with ADHD who struggles to stay focused during history lectures. So, the teacher incorporates interactive maps and timelines into the lesson, allowing the boy to engage visually with the historical concepts. So the second scenario here is there is a girl who's 14-year-old with ADHD who finds it difficult to sit still for long periods. So the teacher incorporates short movement breaks throughout the science class. So this allows the girl to release some energy and return to her work with renewed focus. So next thing what teachers can do and school can do is positive reinforcement. So positive reinforcement motivates students with ADHD and encourages desired behaviors. Teachers can implement strategies like praise and recognition. That means acknowledging and praising students with ADHD for completing tasks, staying focused, demonstrating positive behavior, and all these and acknowledging their efforts as well. Even if they cannot accomplish something, even acknowledging the efforts also reinforces these behaviors and encourages them to continue. Next is reward systems. So developing a point system or reward chart for completing assignments or exhibiting desired behaviors can motivate students with ADHD and provide a sense of accomplishment. So the course, these are the things teachers can help. Teachers and school can help to manage ADHD students. So the next thing is what people ask me is what is the course and duration of psychotherapy for adolescent ADHD can vary greatly depending on several factors, including severity of symptoms. That means adolescents with milder ADHD symptoms may benefit from short term therapy. That is, short term therapy is also here 6 months to a year to focused on specific skills development. So conversely, those with more severe symptoms or coexisting conditions may require longer term therapy, that is almost from 1 to 2 years or more, to address a wider range of challenges. So milder the ADHD symptoms, you need shorter, the therapy would be shorter, that is 6 months to a year. If it is the symptoms are more severe and if they have coexisting condition, therapy may be long term from a year or two. Next is specific needs. So the focus of therapy will tailor the duration. That means, for instance, if organization is a primary concern, therapy might involve implementing organizational tools and routines, taking a shorter time than addressing broader issues like emotional regulation. So according to the specific needs of the child, the therapy is planned, and the focus of the therapy will also, tailor the duration, can minimize or maximize or increase and decrease the duration of therapy. So whatever the concern is, if the concern is emotional regulation, so emotional regulation requires a longer, duration. If the concern is only organization, so this might take a bit shorter time. The next is treatment goals. So are the goals to improve academic performance, manage impulsivity, or build social skills? So each goal may require different lengths of therapy. So, and then is the treatment frequency. So, weekly sessions are most common, but adolescents might benefit from bi-weekly or even, monthly sessions as they progress. So usually it is weekly sessions. It could be bi-weekly sessions sometimes, or if the condition is improving, it could be monthly sessions. The next thing is, we are seeing some scenarios to, see the variability in duration. So mild symptoms. So if it is mild ADHD, so we have to improve organization here. So there is a 14-year-old boy who experiences mild inattentiveness and struggles with organization. So he forgets assignments and loses track of homework. So developing organizational skills like using planners, time management techniques, and creating routines. So next is, the therapy focus could be, here developing organizational skills like we use planners, visual aids, time management techniques, and creating routines. So duration potentially 6 to 12 months of therapy could equip, this boy with the necessary tools for improved organization. The next thing is moderate ADHD. If we have to address something like impulsivity, so here there is a 16-year-old girl who has moderate ADHD with impulsivity causing frequent arguments with friends and family. So here the therapy focus is CBT techniques to identify triggers for impulsivity, develop coping mechanisms like deep breathing, self-talk, and improve communication skills. So the duration here could be, depending on her progress, therapy could last for about 1 to 2 years to effectively address impulsivity and communication issues. So severe ADHD with coexisting anxiety. So symptoms could be, if the symptoms are severe, and he the the boy with ADHD has coexisting anxiety, for example. So here symptoms: a boy who is 13 years old has severe ADHD, significantly impacting his academic performance and social interactions. He also experiences anxiety due to academic struggles. So, here the therapy focus could be a combination of approaches. So behavioral therapy to manage ADHD symptoms, CBT to address, anxiety, and potentially family therapy to create a supportive home environment. So duration, given the complexity of his situation, longer term therapy, that is 2 plus years, might be necessary to address both ADHD and anxiety effectively. These are just examples. A mental health professional will assess the adolescent's, needs and develop a personalized treatment plan with a specific duration. It is important to be patient and consistent with therapy to see optimal results. So sometimes there could be that after completing the therapy as well, they could, the teens may need booster sessions, to address emerging challenges or to maintain progress. So family therapy or family involvement also in therapy, can significantly improve the outcomes, so regardless of the duration. So psychotherapy can be a powerful tool for managing adolescent ADHD. So, but it by understanding the factors affecting therapy, duration, and working collaboratively with your therapist, adolescents with ADHD can find the support they need to thrive. So, here at last, I would like to say psychotherapy is a journey. It is not a quick fix. With consistent effort and support, adolescents with ADHD can develop the skills they need to thrive. So, from here comes the end of the session. So we have discussed almost everything about ADHD. What is ADHD? What are the signs and symptoms of ADHD? How can it impact physical and mental health? What is the role of parents? What is the role of teachers and school? How can therapy impact? So we will discuss in the next session what are the therapies we use to treat ADHD. So thanks for watching. Namaste and stay tuned.